To help kind of put this into perspective, let's look at a case representation with a 44-year-old woman. She comes to a wellness clinic, she gets her regular labs, and that includes a lipid panel. Her history includes uncontrolled diabetes, obesity, and hyperlipidemia, which can be a range of things, kind of like high cholesterol or high triglycerides. It can even be a combination of many different ones. Well, her draw, when we get those actually in those tubes, looks something like this, what you're seeing on this picture, and it's very opaque, and that is very abnormal because this should not be solid up here. And if you kind of think about that, it looks like very similar to what you might cut away from something like a steak. Her lab results, the report itself shows that her triglycerides are exceeding 500 milligrams per deciliter. And the next slide is going to cover exactly what is considered normal. When someone gets a lipid panel drawn in a health clinic or hospital setting, this is the ideal numbers you're looking for. You want a LDL cholesterol, that bad cholesterol, to be less than 100. You want the total cholesterol to be less than 200. HDL cholesterol, you want that one higher, preferably a greater than or equal to 600 milligrams per deciliter. One that's not included in this picture is triglycerides, so I added that one here, and you can see what's ideal is to be less than 150 milligrams per deciliter. If we go back and we think about our case study, her triglycerides were greater than 500 milligrams per deciliter, and that's why you saw so much of that solid white opaque color in that test tube. So if we think about that case presentation of our 44-year-old female, we know that she has hypertriglyceridemia, or high triglycerides in her blood, that really increases her risk for heart disease. What can we do in order to lower that risk now? Well, she's probably going to be put on something like a statin. That's going to be a medication to help to reduce her blood cholesterol levels. Other things that we can do as far as diet, we can do some plant sterols, plant stanols. We can reduce the amount of saturated fat that she consumes, and we can also include things like soluble fiber, because we know that that's going to help to trap the cholesterol that's usually in bile and carry it out. It's going to be excreted instead of recycling into the liver again. So that's one thing. Remember that most types of fruits and vegetables have a combination of soluble fiber and insoluble, but can I think of the inside of the fruits and vegetables as being the soluble source. So including more of these types of fruits and vegetables, whole grains, can help to reduce some of those triglyceride levels. This is a very common argument that I both hear and see. In fact, I had a patient in one of the hospitals I worked with that I went in to discuss his results from his lipid panel, and also to start kind of giving him some medical nutrition therapy in regards to trying to lower those. And he came back with me in a very smug face that, hey, I don't need to cut down on fat, because if you know anything about the Greenlanders, they have a diet that is 50% in fat, which is way greater than what's recommended here in the US. That's 20 to 35% of your calories being fat. Greenlanders, or those who are more indigenous to those cold climates, they consume half of their calories from fat. He goes, and they have the lowest incidence of cardiovascular disease. And in fact, he's right. Absolutely. They do have some of the lowest incidence of cardiovascular disease. Plus, they also have very high fat diets. But what's different from that, if you pause and think about that, what does the Greenlanders diet look like when it comes to their sources of fat? It's not the total fat that is concerning, it's the types of fat. They're eating diets that are high in fish sources of fat, and that's going to include lots of omega-3s, whereas here in the US, if we had a diet that's going to be around 50% of fat, more than likely it's going to be sources that are coming from things like Big Macs or beef, and it's going to be higher in those saturated fats, not the omega-3s like the Greenlanders. And still going back to our case study, if we're trying to help this woman out and get her heart disease or heart attack risk at the lowest that we can, things that we can do as far as diet, we can try to get her to increase the amount of EPAs and DHAs, and those are different types of omega-3s that we can include within our diet that can help to lower the amount of saturated fat that she has within our LDL levels. But so this is the recommendations that we see within our guidelines, but other entities will recommend even higher sources, especially if you've already been diagnosed with cardiovascular disease or high triglycerides. If you want to consume these from natural foods, some of the greatest sources are going to be fatty fish. See, on average, we're only consuming 0.1 or 0.2 of EPAs and DHAs, yet the recommendations are much, much higher when it comes to trying to lower your risk for heart disease. As we continue to help advise Our Lady with the very high triglycerides, we can look at other things like antioxidants. We know that oxidants produce free radicals, and these free radicals are what helps to stimulate things like inflammation in your body, and we want this to be reduced when it comes to assessing your risk for heart disease. So antioxidants from your diet, things like vitamin E, vitamin C, beta carotene, all of these coming from fruits, vegetables, and whole grains, legumes, etc. These can all provide a whole bunch of different things that can act as an antioxidant, which is going to neutralize the free radicals and help reduce inflammation. Think about inflammation being in your arteries, and this is definitely something we want to do. Another part of medical nutrition therapy when it comes to heart disease includes promoting the Mediterranean diet. And this all stimulated from some research done in the 1990s that noticed that populations living in these areas around the Mediterranean had a 90% lower incidence of cardiovascular disease than we did here in the Western world consuming that diet. They also not just had good heart health, but they also had lower cancer rates and longevity when it comes to life. So what they did, of course, most times is that they explored, hey, what is their lifestyle like? What is their diet like? What is the thing that is driving these lower rates of heart disease? And all of the research kind of association or epidemiological research studies came to a conclusion that, hey, their diet is completely different when it comes to the types of foods that they're consuming. And then that led to developing what's known as now the Mediterranean diet. The Mediterranean diet helps to significantly reducing the risk of a heart attack by 50 to 70%. And this are patients that have already had a heart attack. So that is very, very significant when it comes to looking at disease risk. So what does a Mediterranean diet look like? Well, this is a diet that tends to be very high in fruits, vegetables, legumes, also in omega-3 fatty acids, omega-6 fatty acids. When it comes to meat, they tend to have lots of vegetable sources of proteins and also fishes as being their primary source of proteins. They do have still red meats. They have poultry as well, eggs, dairy, all of those things. It tends to be a lot lower than what we see in the Western diet. Usually the Western diet has this in reverse. It's going to have higher intakes of these types of foods versus these. And so if we can reverse this by significantly increasing the amounts, and when I say significantly, the recommendations on the guidelines for Americans is about 3 servings of vegetables a day. Mediterranean diet consists of 5, even up to 7 servings of fruits and vegetables a day. So very, very different. So it's not only increasing these and increasing these types of proteins, but it's also reducing these types of foods as well. This is a good look at an overview of the general characteristics of the Mediterranean diet. So the Mediterranean is going to be low in red meat, low in processed meat, starches, sweets. It's going to have moderate intakes of red wine, eggs, white meat, which really they're meaning lean meat. And when it comes to starches, they're really talking about processed, refined starches here. Moderate intakes of low-fat dairy, and then really high intakes of these types of foods, vegetables, fruits, olives, or olive oils, fish, and this is all coming from having more omega-3s, omega-6 fatty acids, or polyunsaturated fatty acids, whole grains, nuts, seeds, and legumes. This is something that's very easy to recommend to heart patients because we can say, hey, instead of concentrating on reducing these, which is absolutely advisable, we want to start off with saying, hey, I want you to eat more of something. What? You want me to eat more of something? Yeah, I want you to eat more of these things. Start off by doing this. And usually if you increase these, naturally it tends to decrease these within the diet. If we check this off the box, then we'll start to slowly also decrease all of these. With every macronutrient chapter, we do look at how do we kind of look for these types of either heart healthy or unheart healthy types of fats. What does it mean when we're looking at lipids on a food label? When it comes to something that is marketed as fat-free, remember that that means that that product has less than 0.5 grams per fat per serving. If it carries the claim of reduced fat, remember this is a nutrient claim, a nutrient label claim, and it means it contains less than 25% fat compared to the regular product, so like low fat or reduced fat cheeses versus the regular brand. And then if it just carries something like low fat mayo here, it means it has at least 3 grams or less of fat per serving. Because we are in the fat or lipid chapter, we also have to discuss a little bit about what ketosis is. And I mentioned this also within carbohydrates because it has to do with carbs. It's carbs and fats here. Well, actually, all three macronutrients. So a nutritionally induced ketosis is, it really means that a person has been following a very high fat diet that is either moderate, and I really even hesitate on saying moderate, but high in fat, usually low in protein, and very low in carbohydrates. So what that diet is going to look like, and there are different forms of this, but 75% of your diet calories coming from fats, 20% coming from proteins, and 5% of carbs. If someone was to actually go on a high fat and high protein diet, it would prevent what is known as nutritional ketosis, because protein can be used to convert the amino acids into glucose, and it's that glucose that is the trigger point for ketosis. So glucose would prevent ketosis in essence. So ketones is what we're really talking about if we're defining this, the development of ketones. And ketones are formed from fats. So remember that your body really thrives on carbs as far as the energy source. So if you don't have enough carbs, your body's going to have to look for fats and protein to provide either ATP and or glucose. Now, your body can't really make glucose much from fats, but it can make it from protein. It's just not as efficient. In order to still, you have to have glucose to fuel the red blood cells here, and so that's vital. This is where people with diabetes type 1 really come into problems with, is they can't fuel this, at least this part. Whereas if you still have a functioning pancreas, you're still going to meet the minimal requirements to function with the production of the red blood cells. When it comes to fuel and the other body processes, we can still revert to fat to fuel brain and vital functions within your organs. So with this, without that amount of glucose, you are relying on ketones. Ketones are very acidic. It's the acetone, and so you can think about the smell of what fingernail polish remover would smell like, and that is pretty much what is subsiding, fueling these types of processes. And so with this, your body can function, but yet you're going to have these ketones produced, and that ends up being processed through your kidneys and within your urine. And that's how sometimes people will check to see if they are in a nutritional ketosis by checking the ketones that are coming up within their urine. This naturally it will dehydrate the body, so you end up losing an immense amount of water, body water, free body water, and also water from things like glycogen stores. And so you have an initial huge drop in weight, but it's kind of a false weight. It's not fat weight loss initially, it is more water weight loss. And then eventually your body can adapt to using those stored fat sources to reduce weight further. Unfortunately, if someone is relying on a ketogenic diet for long term, it can have a real impact on your chronic health. So, looking at some of the deficiencies that can occur, and you do not need to memorize this at all, but look at some of these types of consequences of following a high fat, moderate protein, and low carbohydrate diet over a long period of time. You can see, obviously, you'll have, and like I always say, you'll have some actual positive results at first because it reduces an initial inflammatory response. But if you stay on it long enough, then you're actually going to have a rebound type of reaction, and you're going to see lots of these types of things that can occur.